So my talk is more conceptual, and I have less data because this is an area, unfortunately, where we don't have a lot of data, but we have a lot of societal concern. So what I'm going to do is give you some thoughts and some ideas about how we may want to approach the convalescent animal. And by that, I'm going to give you some definitions. But the first one is, with my position, my area is animal welfare. It's a new program area for the College of Veterinary Medicine, but of course Dr. Johnson's been doing this in the ag school for some time. And when we talk about animal welfare, it's really helpful, we talk about anything, to be clear what our terms are. And so animal welfare involves a multidisciplinary approach. You can't just use behavior, you can't just use health or performance. We have to have a variety of measures that we put together to try to understand how an individual animal is coping with its environment. But at the same time, some people use the term, in the past, have used the term animal welfare to refer to what our responsibilities are towards animals. So it's made a little bit of confusion is animal welfare about the animal, or is it about us and what our moral responsibilities are? The World Animal Health Organization gave us some clarity on these definitions because, of course, for the World Trade Organization, we're getting more barriers for trade based on animal welfare concerns. So they said when we're using the term animal welfare, we should try to restrict it to animal welfare is about the animal. And when we're talking about what our moral responsibilities are, or our human actions, we should stick with terms like animal care, animal husbandry, animal protection, or on the flip side of that, animal cruelty and animal neglect. Those are about the people, or the people that are caring for animals. And I want to point out that it's helpful for us to have these definitions because when we try to assess the welfare of animals in different situations, we have to be careful that we're not just exchanging one set of animal welfare challenges for another. So when we talk about group house, the discussion we just had, which is really helpful, about should we group house sows or should we keep them in stalls, it really depends on which sow you are in that group and how you're going to cope with those two systems. And it takes a very different type of management style, as we've heard. And the ones that fail to cope are the ones that I'm going to call the compromised animals. They're animals that either are in pain because of an injury, they're getting very thin, they may be emaciated, they may be injured or ill. In my title, I talk about the term convalescence. It's used a lot in the human medical field. It's used less in the veterinary medical field, but I think there's some concepts here that we really need to consider. We've got some really great tools in our pockets for addressing ill animals, lots of ways of giving them vaccines and protocols to prevent disease. And we also have a lot of excellent pharmaceutical solutions for when animals get sick, but we also have animals that fail to respond. And even when we are giving a pharmaceutical treatment, it's important that we are setting the animal up to be able to use those drugs effectively. And the key piece of that is what that animal is doing. Is it doing the things it needs to do to get better? So the term convalescence can be used to mean the recovery of health and strength gradually after a period of sickness or weakness, or it's the period needed for an animal to return to health and illness. So you have it both ways, and of course it's a sliding scale of being acutely ill and then gradually becoming better and being functional again. And any of you that have had a serious injury or illness, or even just the flu, I'm sure you'll recognize that. And I've made this the area of my research program because I think there's some really interesting information from the biomedical research that we can use. Particularly, most of that work has involved rodents, and it's been applied for human medicine. But some of these principles are really helpful for us in veterinary medicine as well. And one of the key things that started the interest in behavior during sickness was a paper by a fellow called Benjamin Hart. He's a veterinarian from California, Davis. And he did a review showing that the behavioral responses that animals show when they're acutely ill are consistent across different vertebrate species. So even if we're just talking about chickens or any of the mammals, we all tend to do the same things. And it's also consistent even if we're infected with a virus or a bacteria or a protozoa. And in nature, that's really unusual, because normally nature prefers diversity. So for that to have evolved, it has to have a survival value or be important for the animal to recover. So he suggested that sickness behavior should be rethought about being as part of the immune response, and that it's a highly organized, evolved strategy to facilitate recovery, in particular the capacity to have a fever and make the internal environment less favorable to pathogens. I also find it really interesting because if I think about our human responsibilities towards animals, one of the key pieces of our social ethic of farming and of animal husbandry has been the caring for animals. And if we go back through some of our pastoral history and culture, the caring of the individual animal is been one that really resonates. Nobody wants an animal to be sick. We all want those animals to recover. So in a nutshell, how do ill pigs differ from their healthy penmates? Well, you guys will be familiar with this because it's the way we usually diagnose disease. We see a decrease in food consumption, decrease in water consumption, activity, exploration, social behavior, and decrease in grooming or care, body care. At the same time, we see an increase in slow wave sleep, which is the non-dream sleep, an increase in heat-seeking behavior, and an increase in pain sensitivity. So that's why some of those pigs tend to be much more vocal, although all pigs are pretty vocal. If we're talking about how we can apply some of these skills, well, some of the things that we know from the biomedical research is that during acute stages of illness, animals will be less willing, or they will be more willing to compete for resting sites because that has a higher value to an animal during convalescence than it does to a healthy animal. They will be less willing to compete for food and water, so they don't go completely off food and water. But if they have to really fight to get there, they're not going to do it. And of course, that's really critical for us, especially when we have something like diarrhea, because the animal can quickly become dehydrated. We want that animal. We want to make it easy for that animal to drink. The animal will be at risk for bullying by its penmates, especially if that animal is down. And the animal will have different needs for heating or for cooling. And so some of the research that we were doing in the lab to try to better understand how a pig's priorities change during illness were first done with an antibiotic-associated diarrhea model, which we chose because we could induce diarrhea in pigs. We knew when they were going to get sick. We knew how sick they would be. And we knew that they couldn't make other pigs in a group sick. And we did that by giving them 250 milligrams per kilogram of ampicillin, which we fed to them in milk. They willingly drank that, so we could train them to drink this milk mixture over several days, and then for some pigs we could add the antibiotic and make them sick, and other ones we did not do that with. And that would reproduce mild to moderate diarrhea for a period of 24 to 48 hours, so we could compare the behavior of the pig prior to its illness as it became ill and when it recovered. And one of the first experiments we did was in behavior, we can do things that we call motivation tests to see what areas or what resources are preferred by the pig. This was a very complex pen, a raised deck, that the pig had a number of different resources and it could enter different compartments to access those. What we see here at the front is the pig has two identical resting areas. There's a heat mat, or a heat lamp on each and a rubber mat, so it's equally comfortable. You can't really see that in between there's a solid partition between those two areas. And the piglet has to go through under a barrier, there's a hanging curtain for it to access the site on the left. We see him in the site on the left because he has nose-to-nose contact with some penmates he was familiar with. So he lives alone in this group, in this pen, but he previously used to live with those pigs in the next pen. And what we found was we can work out how much time he spends in these different places, and then when he becomes sick, what we found was the pig spent more time resting, as we expected, and he preferred to rest in the heated area. So when you're ill from diarrhea, you want to have additional warmth. But he also spent much more time in that social area. So it wasn't just that he was resting. He had multiple places he could rest, but he wanted to be in with his buddies as well. Now that's important because some of the literature says that normally we isolate ourselves when we're sick. But for baby pigs, because of the way they've evolved, of course, they're used to huddling together, and there's a lot of protection in a group. So if we have the question of should we remove a pig from a group and put it into a hospital area, this is where we start to get into some fuzzy ground. We then went into some groups of pens where there was a large a relatively large pen for this group of 3 pigs. And as I said, we could train them to drink the milk mixture, and then we would choose the middle-ranked pig, and on a particular day we would make him sick. And what we found was that the behavior patterns we found when the pigs were isolated disappeared when they were in a group. Okay, so he did not spend any more time resting, either compared to his previous behavior or compared to his pen mates or compared to pigs that were in another pen that were not sick. He spent less time resting on the heat mat. Now in this case we didn't have heat lamps. The heat mat is the area at the very back. If you look, you can see that orange square, and you can see that that's a very small area for the number of pigs there. And it's possible that he just wasn't able to compete for access to that spot when he was sick. And part of the reason why we think that might be true is because we also found that, contrary to our expectation, the pig became more aggressive when he was sick. We thought he was going to be bullied, but actually he was more aggressive to his pen mates. We followed that up with some work with Salmonella, where we had pigs in biosecure rooms, 5 pigs per room. 1 pig was inoculated with Salmonella, and the pigs were necropsied 7 days later, and we looked at the tissues to see colonization within that group. In general, and we had the pigs marked, and we videotaped them with the observers blind to the treatment, so they didn't know which pig was sick. When we analyzed the behavior of the sick pig was very subtle. There were very few differences between the pig that had Salmonella and his pen mates. One of the things we did find was that the infected pig spent less time on the floor versus the raised deck. Now this was in a biomedical facility, so it had a concrete floor, but it had a little raised deck where the pigs slept, kind of like one of those dog raised areas you might be familiar with. And they had food up there, and they also had their heat mat, and their dunging and larger play area was down in the concrete. So the sick pig spent more time up on the raised deck. And then when we looked at the transmission at the group level, we found that the groups that spent more time on the floor, or spent less time on the floor, were more likely to be infected. And that may be, we didn't collect that data, but it may be that the sick pigs were defecating up in that raised area. And part of the reason we think that is because there was a clear association between hide score. So in pens where pigs tended to be very dirty, there was more transmission, which isn't a huge surprise because we know a little bit of that work from cattle at Lairage as well. An interesting one was that in groups where there was more belly nosing and ear biting, ear chewing, we found more transmission of Salmonella in those groups. And so we're putting some of these concepts together. We think through, well, how should we be managing our sick pigs? When we're talking little baby pigs here, it's probably more practical economically to treat them within the group, but we also have some evidence here from the behavioral trials that they would prefer to be in the group, but we may need to think through the pen design. From some work we did in Ontario where we went and did a survey on 100 swine farms. We asked them questions about hospital pen use. I'm not going to summarize that here, but one of the key things that came out of that study was that there was a lot of variability within the industry between how important hospital pens were, or the convalescence of pigs, and whether they had standard operating procedures to deal with that. And you could see some of these differences in the terminology that was used. So we talked about hospital pens. Some farms, they actually had thought-out infirmaries. In some places, they were called treatment pens or isolation pens, but we also had some that just called them the sick pen and the death pen. And does that terminology matter? Well, maybe not. But if we're looking at we asked if they had a hospital pen, we asked them to show us that hospital pen, and we would take photos. And this was the hospital pen on one of the farms. And you can see that this is, for a variety of reasons, this is not what I would consider a hospital pen. And there's not a clear standard management procedure. And of course, there's also, this is an animal welfare issue and potentially a public relations disaster. You don't want a pig that's basically in its last stages and you haven't gone in and chosen to euthanize that animal. Because the questions come up, how long has that animal been there, and what is your plan for that animal? And if you don't have anything to say, then that's going to raise some concerns. One of the key things that came out of that survey was that was just really more in our informal comment section, is that a lot of the producers really struggled with euthanasia and decision-making about where those humane endpoints were. And some of that was because of, there's just technical challenges, as we all know, with euthanizing pigs. But in some cases we had pigs in this situation that it wasn't because of technical challenges, but in some cases psychologically it's a very difficult task to do, and it was getting put off to the end of the day, and then it was much easier to say, well, I'll see what she's like tomorrow, and then they put off to the end of the day, and then you get into this cycle where you never actually make the decision. So I think there's some neat stuff we can do with that if we draw from what's been done with laboratory animals and some of those decision trees. One of the other things that came out of that study, though, was when we asked, what sort of treatments do you do to a hospital pen? It really ranged. So here's where you can see some of the farms where they had a clear protocol and some that didn't, where it ranged from, on some farms they went and inspected those pens 5 times a day, and they maybe had data collection sheets so they were clear what information they were going to track for those pigs. In other cases, we had farms where the pigs were never inspected again. So they would refer to them as the death pen. And basically that was a holding place until the pig eventually was euthanized or shipped out. So how do we develop a management plan and standard operating procedures? Well, it's going to really vary farm to farm. So some of the things that we need to be working on is criteria for removal of pigs to hospital pens. As I said, with the little baby pigs, that may not be the plan that we want to do, both because of the pig, but also because we know that those diseases tend to go through the whole group anyways as a whole. But with other group-housed pigs, especially group-housed sows, and some of the older pigs, specific clinical signs such as dehydration, evidence that those animals are not accessing the resources they need in the pens they are currently in. We can look at their performance records, so if you're seeing that the pig's body condition score is going down and so on. And then if there's evidence of bullying by other pigs, excessive nosing and chewing, so looking for things like lesion scores, bite lesions, or around the abdomen and navel, you can see the inflammation where there's been a lot of nosing of those pigs. Clear criteria for on-farm euthanasia, both in terms of at what point do you decide this animal has failed to respond. So you put it onto an antimicrobial treatment with the veterinarian, discuss at what point should I see a difference. If you don't see a difference in 24, 48 hours, then either change the drug or go through another different, you have to have a different decision tree for that. And recognizing evidence of acute pain and distress. And then we also, within that piece, have to have criteria for timely shipping out of animals that maybe aren't suffering at the time, but are not going to be able to go through the market chain in the regular way as a normal pig. So what we're looking at here is a pig with a large hernia, as we were just talking about earlier. Is this an animal welfare issue? We don't really know. We know from human self-reporting that these are painful, but the animals remain on feed. It is difficult to assess, but one thing that is clear is that as the hernia starts to become really large like this, it's reasonable to expect that some pain will occur, but more importantly, that animal is going to struggle at marketing. So shipping that animal out early and taking him directly to a processor instead of through other marketing chains is an important consideration. One of the things that I would urge you to do is where you are having sick pens, or if you have animals that are severely compromised, that you are tracking some of that information so you've got a paper trail. And part of that is because if you have an animal cruelty complaint against you, then some of the evidence that would be gathered is this following standard management procedures? We have got a real fuzzy ground on what standard management procedures are when we get into these compromised animals, and there's a lot of differences of opinion. But if you've got that pig that I showed earlier that's just out in the alleyway, and you don't have any documentation to say, oh, when she was there and what sort of treatment plan was followed, then you're really vulnerable. But if you can say, you know, I just moved her out there 2 hours ago, she was in a hospital area, she failed to thrive, we euthanized her, or she passed away and we've moved her out, then at least you've got that paper trail if that gets questioned. And you can also say, this is a rare event, and here's how I can document that this is a one-off as opposed to this is standard on this farm. So collecting some of that information, and some of this may be practical and some of it may not be practical in some farms, but some of the ways we deal with it in laboratory animal fields would be targeting appetite. So obviously, sows and stalls are much easier to track this information on than sows in groups, where you can look at feed refusals, but also latency to begin feeding. So as you're walking through, she may have finished her feeding from the night before, but if she's not getting up and she's not diving her nose in when you go to feed her, then that should be raising a red flag. And then with animals that have gone off feed, if you give them a different food, a preferred food, usually sweets, or in some cases some forages, normally pigs would go after those right away. So you're able to, again, assess the amount of inappetence of that pig. Her alertness, does she respond to a startle test, to touch, and in a group situation, does she move away from you? The dehydration scores, and as I mentioned earlier, the lesion scores. And then the second piece, of course, ideally we want those animals to return to health, but in other cases we have to euthanize them. So I'm going to focus on euthanasia for the last few slides. Euthanasia, the definition is good death. Euthanasia ideally should be painless, and it should not involve fear or distress. That's our aim. We don't always get there, but that is where we should be trying to go. But the other practical considerations are worker safety, aesthetics or acceptability, technical skills and reliability, and the cost, which also includes carcass disposal. The ways that, as a scientist, we can measure whether a death is humane or not, or whether a particular euthanasia method is humane, we can go through behavior measures, physiology, and neuroscience measures. So some of the behavior measures would be struggling. Of course, that has to be conscious struggling because we have the involuntary contractions after an animal has been euthanized. We can assess vocalizations in terms of frequency, the number of calls, but also we're getting more information about the pitch. The higher the pitch has been associated with pain in little piglets. And then we can do some aversion tests, and I'll talk about one as I go through the methods later, but that's using the animal's motivation to tell us about these. With physiology, we've got our stress hormones. Some of those are going to hit the ceiling during the restraint stage, so they're not going to be very sensitive to telling us about the euthanasia method itself. But other ones are a little bit more sensitive and are more associated with emotional states. We've got our heart rate and our respiratory rate. And then we've got our neuroscience measures, such as measuring brain activity, and then on postmortem, looking at the evidence of traumatic brain injury. A key component is assessing when death occurs, and that actually has been a huge challenge within the scientific literature of exactly when do you consider the animal to be dead. Now remember, if it's euthanasia, it means it didn't feel fear, pain, and distress. So to an extent, it doesn't matter as much how long it takes to die as long as it's insensible, because insensibility means you can't feel anything. So that should be our first concern. The second one, when it actually is assessing death, is the animal should have a lack of an eye blink response, the lack of response to normally a toe pinch, or you can do a tail pinch or a nose pinch in a pig, the lack of the righting reflex, cessation of respiration and heart rate, and cessation of brain activity. The gold standard, of course, is cessation of brain activity, but that's not practical on the farm. Now, with many of these activities, you'll see muscle contractions occurring after loss of sensibility and death. But you also should be aware that sometimes you see that really rapid eye blinking, and that is not an indicator of insensibility, because that can happen in conscious and in unconscious states. It just means it's involuntary. It doesn't mean that you're unconscious. So let's go through these methods one by one. The AVMA considers anesthetic overdose to be the best method. It works by first anesthetizing the animal, and then it causes respiratory and cardiac arrest. You can do it two ways. You can sedate the animal and then do something like a cardiac puncture if it's a little baby pig, or you can do IV administration. There's minimal pain or distress involved because you are sedating the animal, making it unconscious. Animal restraint will be required, obviously, and that can cause some fear and distress, but in generally it's very mild, and it's also safe for the workers, and it's very aesthetically pleasing, or as it can be, I suppose. The barriers for on-farm use, obviously it requires veterinary intervention since it's a controlled drug, and carcass disposal is an issue, and hence cost is prohibitive. Concussive force, death results from traumatic brain injury. With this method, the animal restraint is again required. This one tends to not be aesthetically pleasing. Well, I guess it's definitely not aesthetically pleasing, but it tends to be very effective. The nice thing about this method is there's a lot more control if you're good at what you're doing, as far as it being instantaneous. So blunt force trauma for farrowing room piglets only. We've got non-penetrating captive bolt pistol, the Zephyr, which I'm going to talk about in a minute and give you some data on. We've got penetrating captive bolt pistol with different ones that are coming out, some new ones that are coming out that may kill as well as stun, but most of the other ones just stun, so it usually requires a bleed out afterwards. And then gunshot, 22 caliber is the most common method. Usually it will kill, but sometimes it will only stun, so in some cases you may also need to come back and bleed those pigs out. So the Zephyr was recently examined by Dr. Tina Wadowski and a group at Guelph, Canada. It's basically a nail driller. It's a little handheld thing that they put a device on so that it causes concussive force for non-penetrating force to kill pigs. What they found, they tested it in the lab first with skulls and then with a few live pigs in a pilot study and found it was really effective. And then they went out to test it on farm, and the results came out pretty darn poor, unfortunately. The reason why they chose to go with the Zephyr as opposed to just straight blunt force trauma is because of the aesthetics issue. So blunt force trauma tends to be effective, but it's also 75% of the people that use it prefer to not use it. They don't like it. So, and one of the key things is the restraining of the pigs. So the Zephyr would get rid of some of those aspects of it if it was working well. But this is some work she presented at the Layman conference showing that blunt force trauma was significantly better than the Zephyr in terms of the duration of limb movements. So you can see with blunt force trauma in gray that those animals were faster to cease moving their limbs and faster to cease their heart rate compared to the ones that were killed with the Zephyr. The blunt force trauma also outperformed in terms of the duration of the heartbeat, as I mentioned. And a key factor was that of the 76 pigs that were killed with blunt force trauma, none of them returned to sensibility, whereas 13 of the piglets that were euthanized with the Zephyr returned to sensibility. So that obviously is not going to be acceptable, and that's why it's absolutely critical that in any of your euthanasia protocols, you are making sure that you're ensuring death before you go away and leave that pig behind. Now, what they found with this was they had multiple, I think they had 7 of the guns out there, and there was some variability on the mechanics of those guns. And so they've actually refined it since then, and it is performing better. But I think it's important for us to recognize that blunt force trauma, if it's done well, is very effective. One of the other key factors that we have to think about is that everybody's a different individual, and some are going to have better skills or willingness to perform some methods than others. And if we need these pigs euthanized, it's better that we do it, and rather than just leaving that decision, as I talked about. This is condensed a little bit from her graph, but what we're looking at here are 4 different stock people out of the group. And you can see stock person C differed. What we're looking at here is the skull fracture score. So in this case, a low score is not ideal. And we found that stock person C was less successful in achieving a skull fracture score when she was using, or he, I'm not sure whether it's he or she, using blunt force trauma. And this differed significantly from the performers of all the other stock people when they were using blunt force trauma, and for the Zephyr as well. So C just really was not very good at this job. And that's important to recognize. And it could be because of physical differences, because they haven't learned the techniques very well, or because they just find it really emotionally upsetting, and it's interfering with the way that they're doing that. But it should be pointed out that 0 out of 9 pigs returned to sensibility with the blunt force trauma with this stock person. And so it may also be that they just had a different method that was equally effective. The pigs actually died, but it didn't have the skull fracture that the other stock people were achieving. Carbon dioxide gas is also getting a lot of attention. Oh, the other thing I wanted to mention, sorry, before I get off that, a caution with this. These experiments were done with all piglets that were under 24 hours of age. So where our trouble spot is, of course, is as we get into that 3rd week. So blunt force trauma is acceptable in the farrowing house, but where we're getting into problems is the larger pigs, you can't do the overhead hit as well, or sometimes there's differences in the abilities of pigs righting themselves and moving away, and that's the piece that we really need to tackle. So hopefully some of these new captive bolt pistols, they're coming out for the baby pigs, are going to help us there. But in the meantime, another method that's worth considering is carbon dioxide gas. We know that 80 to 90% CO2 causes unconsciousness within 13 to 30 seconds. Some of you might feel that 30 seconds is a long time. And that can be a long time, but it's not clear that the pigs, of course, become drowsy, and it's not clear that how aversive they find that. And there's different reports. There was the initial work that was done out of the UK had the pigs trained that if they went into this chamber, there was food there for them, so the pigs obviously would go in. And then you increase the amount of CO2 in the chamber, and you can titrate at what point do the pigs choose to not go in the chamber to eat, which for a pig is a big deal. So pigs definitely detect it, and they definitely prefer to not have it because they won't go in there and eat even after 24 hours of food deprivation. So that would suggest they find it aversive. But then another study that was done in Australia was moving in groups of pigs and dropping them down into the chambers for processing style euthanasia killing. And they had three treatments, one where they went into the 90% CO2, one where they went into 60% CO2, and one when they went down into that chamber, they were given an electric shock with an electric prod. And then they returned the pigs back up, so none of them died. So they were down there for 30 seconds, and then they came, or 30 to 60 seconds, and then they came back up, and then they did that several times, so that the pigs learned when they went in there that they were going to go down and either they were going to get a shock or whatever. And they found that the pigs that got the shock were absolutely by far the least willing to go into that box again. So that was the most aversive. And then 60% and 90% CO2, the pigs didn't show aversion to going back in that box and going down. So the reason why they did the 60 was because there was a question of whether the pigs remembered their experience at 90%. So when you're doing these experiments, you have to really understand how the cognitive function works. Last one is electrocution. Causes insensibility of the brain followed by cardiac arrest and loss of oxygen to the brain. Electrodes must be positioned on either side of the head so the current flows through the brain, and then an electrode attached to the hind leg for cessation of heart. And in different countries, you may not have to do just to the head. You may be able to do just nose to leg. So in Canada, I think you can still do nose to leg. It requires 300 volts. So this is a limitation for on-farm use because many farms only have 110 volts. But there are some human safety concerns, but there is a mobile unit that's under commercial development. Was started in Montreal, and I'm not sure when that's going to become commercially available, but it's only using 110 volts, and it looks fairly promising. But of course, the one question with electrocution is whether the pigs are aware of it. You know, with the electric shock that I was talking about in the previous experiment, it was obviously a much smaller shock, and it didn't render them unconscious. But we don't really know, and we don't have any way of really testing whether it's painful to be electrocuted. So in summary, compromised pigs represent vulnerable populations that need special attention. We need thoughtful standard operating procedures, and we particularly need to be tracking our information both to refine our SOPs, but also to show accountability if our animal care is questioned. And euthanasia is a critical component of this. We do need more scientific research on it. There's almost, I think that one that I talked about with the captive bolt pistol, I think that's the only one that actually collected empirical data on that method, which has been our #1 method for a zillion years. And with that, I open the floor to any questions or discussion. Sorry, I was really whipping through there, but yes?
What are we looking at for on-farm scrutiny about this?
For which? The euthanasia or sick pigs or both?
Both.
Almost all of our animal care guidelines say that you have to have provisions for sick pigs, and none of them say what that means, except for this new stuff that's just starting to come out of Denmark now, and it's really the work of, I think, 2 people that are doing it. So we have very little data collection to validate it, but it is a huge public relations issue. So I guess I'm not sure how to answer that. We are going to continue to have public scrutiny on what we're doing. I think we need to be able to talk about the methods we're using and the pros and cons and why we're making particular choices. And I think, by demonstrating that we are on the issue, that's a big piece of it. It is a challenge. Nobody wants a sick pig, and we are working on that one. Yes?
Why do you think the Zephyr works in the lab but doesn't work on the farm?
Yeah, the question was, why did the Zephyr work in the lab and not on the farm? Because in a farm condition, you have a lot of things going on. So there are two issues. One is that you had now 7 people that were all trained, but had been using blunt force trauma as their usual method, and had not had as much time to be experienced with Zephyr. So that might be one. And then just the variability. They didn't test it empirically in the lab. They tested it on just a few animals, and it appeared to be effective. So it may be that was the particular gun that had better mechanics, or it could be there are some challenges on farm in terms of restraint and placement that could have, when you're rushing through, of course, because you're euthanizing pigs and you have 10 million things to do that day. So you're trying to condense everything down fast, and you're more likely to make mistakes.